Good day everyone, we are Group 4 and today we will be discussing the theory of recent action. So for a brief introduction lang po, so what is the theory of recent action? So this theory po is used to believe that some action or behavior will lead to a consequence. So for an instance lang po, halimbawa lang, someone's mindset po na pag nag-diet ay papayat and they will be physically fit. But syempre, in order for that to take effect, we have to improve every other aspects po, such as our sleeping habits, our workout routine, syempre po exercising for us to be physically fit. But the effects po, I think it will be different kasi syempre po magkakaiba naman po tayo ng body types. So yun lang po, and my group mates will explain it further later on. So for the topic outline, here we have the associated theories, the theory of planned behavior, its definition and goals, the 6 constructs of TPB, the theory of action or planned behavior examples, limitations of TPB, and the last one, considerations for implementation. So, i-discuss po yan one by one mamaya. For the learning objectives, first one po, for us to be able to learn the concept of the theory of action or planned behavior. Second one, to be able to determine the 6 constructs of TPB. And the last one po, to be able to distinguish the limitations of the said theory. So, for the associated theories. So, two closely associated theories po is, yun nga po, the theory of recent action, and the other one, theory of planned behavior. So, ang sabi po dito, they imply that a person's intention to engage in an action determines their health behavior. Of course, sa intention po ng isang tao, kung harmless naman po siya, it will determine that their health behavior is in a good state.
So, ano nga ba yung theory of planned behavior? So, yung theory of recent action was first proposed in 1980 by Ajzen, and pinalitan niya ito into theory of planned behavior. So, ina-explain ng theory na ito na ang ating mga beliefs o paniniwala ay nakaangkla sa magiging behavior natin. So, it predicts human behavior and can be applied to healthcare. So moving on, theory of planned behavior states that behavioral achievement depends on both motivation or intention and the ability or behavioral control. So its main component is the behavioral So ano nga ba itong behavioral intention? So these are influenced by the attitude about the likelihood that the behavior will have the expected outcome and the subjective evaluation of the risks and benefits of the outcome. So, sabi nga ni Ajzen, no, ang mga intensyon ay palagay natin sila yung umaalam sa mga motivational factors that influence a behavior. So, dito pinapahiwatig how hard people are willing to try or gano'n sila ka-effort gawin ng bagay ito in order to perform the behavior. So, yung general rule sa theory na to based kay Ajzen ay the stronger the intention to engage in a behavior, the more likely should be it's performed. So, theory of planned behavior ay may 3 main components. So, ang first ay personal attitudes, second ay ang subjective norms, at ang third ay ang perceived behavioral control. So, these factors motivates our intention as well as that intention influences yung magiging behavior natin. So, theory of planned behavior have 3 goals. So, first is to predict the intention of an individual na gawin ang kilos na ito. Second ay ipaliwanag na ang mga tao ay may kakayahang pigilin ang sarili sa paggawa o hindi paggawa ng kilos na ito. Third, used successfully to predict and explain different health behaviors like smoking, breastfeeding, drinking, health services utilization, and substances use, and many more. So, for example, no, kunwari ang dad mo ay alcoholic and lagi siyang wala sa bahay. So dahil dito iniisip mo ay bad behavior ito. Kaya naman yung planned behavior natin is to never drink kasi ayaw mo matulad sa papa mong alcoholic. So another example, for instance, is that you have this barkada na laging nag-iinuman kasi they think na drinking is fun. So, tapos ayun na, in-invite ka na mag-party, and yung pag-accept mo sa invitation na ito and ang pakikipaghalubilo sa kanila, this means that you consider this action good kasi you think you belong to that group of people, and ang drinking ay parang normal or standard lang na behavior sa group na yon. So, dito papasok yung social norms.
So next is the 6 constructs of theory planned behavior. So first is i-identify muna natin yung meaning ng constructs. So constructs is the conceptual elements or idea na nakaka-affect sa theory planned behavior. So sinasabi na subjective ito since nakadepende pa rin naman sa tao kung ano yung gagawin nilang behavior sa certain event or situation. So since sa alim nga to, una na rito is yung attitude. So, attitude refers to the degree to which a person has a favorable or unfavorable evaluation of the behavior or interest. So, attitude is the way of thinking and feeling usually for a certain situation or event nga. So, nandyan na yung mental position ng isang tao na nagfo-focus sa kung ano yung naiisip nila para sa situation na yon, as well as yung feeling and emotion na nagfo-focus naman sa kung ano yung nararamdaman nila sa situation na yon. So, next is yung behavioral intention. So, ang behavioral intention naman, it refers to the motivational factors that influence a given behavior, where the stronger the intention to perform the behavior, the more likely the behavior will be performed. So, nasabi na siya kanina, or nabanggit na siya kanina, which is identified as the main component ng theory planned behavior. So, ang pagkakaiba ng attitude sa behavior is yung attitude is yung naiisip at nararamdaman lang ng isang tao towards sa situation na yun. However, yung behavior naman is yung action na gagawin niya para sa situation na yun. Next is subjective norms. So, subjective norms refers to the belief about whether most people approve or disapprove of the behavior. So, nasabi dito na yung belief na most people disagree or agreed upon on. So, masasabi siya na subjective kasi nga, depende siya sa tao. Example nito is, kunyari, yung neighborhood nyo naniniwala yung mas marami na kapitbahay na yung immunization is bad, and ang concept na pinaniniwalaan nila is naglalagay ng microchip sa bloodstream yung immunization, kaya siya naging masama. Possible na ma-viewed siya na tama since marami nga yung naniniwala. So, ibig sabihin na kapag kunyari may isa na nakakapag-immunize na parent para sa kanilang children, possible na ma-viewed sila as bad since naniniwala nga yung karamihan na tama sila. Fourth is yung social norms. So, kapag naman social norms, it refers to the customary codes of behavior in a group or people or larger cultural context. So, hindi siya katulad ng subjective norms. Since yung social norms is mas malalim yung foundation niya dahil nga nakaugat siya sa culture ng isang society. So, madalas, ito yung mga kinamulatan ng mga tao sa society nila kasi ito yung nakikita nila sa mga elderlies ng kanilang community. So, dahil doon na ipapasa yung certain tradition as well as yung norms sa mga new generation. So, example na rin dito is yung paggamit ng herbal plants sa provinces, no? Ang paggamit naman nila ng herbal plants is hindi sa against sa hospitalization. Ginagawa nila dito para as substitute or alternative para na rin sa healthcare system nila sa kanilang lugar. At maiwasan na rin yung parang pag-travel and yung pag-cost ng mahal sa mga hospitals. So, since nga alternative and substitution sila ng medicine, nakikita ng mga new generations kung ano yung ginagawa ng mga elderlies nila sa halaman. That is why naipapasa siya over time. So, next is perceived power. So, this refers to the perceived presence of factors that may facilitate or impede performance of a behavior. So, pwede siyang ma-viewed as negative, which is yung nakakapag-hinder as well as yung problems or barriers. Pwede rin naman siyang positive na pwedeng makapag-boost sa isang tao and maharap yung situation na nararanasan niya. Lastly is perceived behavioral control. So, this refers to the person's perception of the ease or difficulty of performing the behavior or interest. So, yun nga nasabi na it is the perception ng tao kung gaano ba kadali or kahirap yung gagawin niyang behavior sa situation na nararanasan niya. Next is the theory of reasoned action or planned behavior example. So first dito is yung Sip Smarter, which is a health promotion program implemented in rural Southwest Virginia, which has a goal of program to decrease sugar-sweetened beverage consumption among adults. So, hindi lang siya adults kasi na-under din dito yung mga young adults, which is 19 to 39 years old, as well as yung adults nga, which is 40 to 65 years old, both male and female. So, this program focuses on awareness building as well as behavior modification in the areas of diet, nutrition, as well as obesity. Okay, yung next and last na example natin is yung 123 POP, Easy Steps to Prevent Cervical Cancer, which is a cervical cancer prevention program na nakadesign for women in rural Appalachian, Kentucky. So, this program components include strategies to increase knowledge and modify attitude, beliefs, and behavior using the theory of planned behavior as a guide. So, ang under dito are female, which is young adults or 19 to 39 years old. So, ang program focus naman is for awareness building, behavior modification, as well as self-efficacy sa areas ng HPV vaccination.
So now, let us proceed to the limitations of TPB. So the first one, it says here na ang tao ay may kakayahan, merong opportunities and resources na gumawa ng certain action that they desire without minding of the intention behind their action. Hindi rin kasama sa theory nito yung other behavioral factors katulad ng emotions or feelings, yung fear, threat, mood, or past experiences that can impact a person's behavior or his tendency to take an action. Though, kino-consider ng theory nito yung mga normative influences, for example, yung peer pressure, it does not cover or take into account those environmental and economic factors that may affect the person's intention to perform a behavior. It also tells us that the behavior is a result of a linear decision-making process and does not consider that it can change over time. Hindi natin madedetermine through this theory kung ano ang certain action na dapat nating gawin o kaya naman kung magbabago ba talaga yung magiging behavior ng isang tao. Ayan, sabi dito na ang perceived behavioral control, yun yung tanong sa sarili natin na, can I do it? Yung perception mo yon sa certain action. So, yet, it did not say now we have an actual control or we have no control at all over the behavior of others. Next is the time frame between intent and behavioral action is not addressed by this theory, and merong mga certain circumstances na nagkakamali rin yung predictions na nagawa or na-produce using this model. Next are the considerations for implementation. So, yung theory of reasoned action and or planned behavior helps us to make predictions about health behaviors, as well as sa pag-plan and implement ng mga health promotion programs, but sa mga ways on how we can prevent such diseases. So, yung subjective norms, yun yung tanong na, what do others think? Pwede natin yung gamitin to describe the behaviors of healthcare providers, patients, and other people within the community. So again, this model is useful to make predictions and it can guide healthcare programs such as health promotion, disease prevention, counseling, campaigns, and the like. So again, these are the references that we have used all throughout the presentation, and I am Rachel Gallo together with Miss Ignacio, Miss Josol, and Miss Anonuevo. Thank you for listening.